Hello, dear viewers. My name is Alexander. We are on the Synthesit channel. Here, people and doctors who take our mineral share their subjective and objective experiences. And today we have Olesya as our guest. Olesya, the doctor. Basically, Olesya, hello again. Please tell us about yourself, where you live, what you do. Why did you take Synthesit, and what are your impressions?
I am a doctor, an obstetrician-gynecologist, and a reproductive health specialist. I work on pregnancy planning and treating infertility in couples. As for this medication, I took it myself to see and try it out. As a true doctor, I experience a range of medications firsthand. This is to understand the possible future prescriptions of these types of products for my patients. What can I say about this medication? In order to understand the possible future prescriptions of these types of products for my patients, what can I say about this medication? I took it for a month and a half as an immunomodulator, considering it was the winter period. Chronic fatigue. We have it present. In general, probably everyone does. With this goal, I took it as an alternative to vitamin D, since at that time I had complaints about constant drowsiness and fatigue based on how I was feeling. And during the laboratory analysis of vitamin D, it was actually normal for me, considering the long period of its use at that time. Considering that this medication in this regard I am also as an immunomodulator, I decided to try it on myself as a sort of cheerful vitamin, a little supplement that would give me more energy. Overall, I can say that the drug had a pretty good effect on me. I also liked this type of drug, its products, in liquid form. For me, this is very acceptable. I don't like to drink. I'm not a fan of taking pills by the handful. This form of the medication suits me just fine. That's one. Secondly, I really felt a positive effect from this therapy. So I do feel a surge of energy. In addition to that, my productivity has increased. The only thing is just me. Right now, I can't say how long the cumulative effect of this medication lasts, how long it will last for me. So I just finished taking it. My therapeutic course lasted for a month and a half. Next, I have now discontinued it. I'll see if this medication has a stored cumulative effect or not. If I start feeling any changes in my body again, then most likely I'll have to take it again. Or maybe it will be taken seasonally in the fall or spring.
Good, wonderful. With your permission, I'd like to ask a couple of clarifying questions that will, so to speak, shed light on your story. I would like to ask for a short pause now. Okay. You took it for a month and a half. What dosage? Was it 1 capsule or 2 capsules a day? How did you take it?
1 capsule.
1 capsule a day. I understand that your weight is around 60 kilograms.
Yes, excellent, excellent.
Regarding the cumulative effect, I would like to say that it will be useful for the viewers, and I think it will be useful for you as well. According to my observations, I've been taking the medication for 2.5 years now, and I've been interviewing people who have been taking Synthesit for about 2 years. Accordingly, I see how people feel the results after the first course. The results can last from 1 week to 3 months. It depends on the person's current health condition, on the state of health they had when they started taking the medication, and lifestyle plays an important role. So the healthier the lifestyle of the person taking Synthesit, the longer the effect lasts. This is what I see. So you can confidently expect that your results, since I think you're a doctor, you still lead a more or less healthy lifestyle. I think it definitely lasts a month.
What you said is a demonstrative healthy lifestyle for your patients.
Of course, yes, because who, if not you, should set a bright, clear example for them, right? So I think you can expect the effect to last at least a month. And also, again, pay attention as a doctor to Synthesit. As you correctly said, it's an immunomodulator, meaning it can help the body, both directions. Accordingly, it has additional properties such as blood thinning, stimulation of hematopoiesis, meaning blood formation, and correction of liver enzymes, as well as aging enzymes like adenosine deaminase and xanthine oxidase. So regardless of how long its effect lasts, it's advisable to periodically maintain it. To take Synthesit, so once a month or once every 2 months, but as they say, it depends on finances. So, if a person has the opportunity, they don't have to take it constantly. Let's say take a capsule of Synthesit every other day. I observe very different dosing regimens. Does anyone take the regular standard dosage and, for example, splits it in half? And just like that, then they take half a capsule a day, and that works well. Wonderful. Could you please tell me, Olesya, about the results you described? The ones where you felt a surge of energy? Well, looking at it, even though vitamin D seemed to be normal, it still wasn't enough. This result appeared after how long from the start of taking Synthesit? After a week or two, not earlier. Yes, I often tell our consumers that people react differently. I only felt it on the third day. So most people feel it on the third day, but there are also results after 2 weeks, within a month. So that's normal. Okay?
From the perspective, but by the way, for those who are women, the effect will be a bit slower, considering the menstrual cycle of a woman. There is physiological blood loss, which also affects women. So this definitely needs to be taken into account.
Yes, dear women, please take note. If you are starting to take Synthesit and you have those kinds of days coming up, then, just plan for a little slowdown. Result. Yes. We are all different. Everyone has individual characteristics, so some might feel it a bit earlier. And could you please tell me, as a woman, how would a woman look at this from a cosmetic perspective? Yes, there's the growth rate of nails, hair, and something about the skin changing. Have you noticed anything like that?
No, well, skin, hair, dermis, all of that is derived from women with tetrad dependence. The rate of nail growth, hair, something, has the skin changed? Have you noticed anything like that? Plus, therefore, it won't get any worse. We are adding these funds. If she truly has a hormonal imbalance, we won't be able to resolve the situation with just Synthesit. And as a plus, of course, it's in combination when a woman has skincare, injection treatments, and some therapeutic aspects, plus all the biologically active supplements. On top of that, her hormonal background is restored. She is perfect.
Then yes, of course. Dear women, dear viewers, those who will be watching us, it's very important to stick to a comprehensive approach everywhere. The more attention you pay to your body, the more ways you interact with it. You apply it to your body and soul. This can involve special psychological techniques, diets, sports exercises, additional dietary supplements, any medications prescribed by your doctor, and specific physiotherapeutic procedures. That is, the more parties you involve, the faster accordingly your desired effect will be, and after achieving that effect, dear viewers, never put off continuing to maintain a healthy lifestyle, because as soon as you achieve a good result, you need to solidify that result and then maintain it. This is very important because, as you know, many people, especially Russians, tend to think, oh, it will just pass on its own. Yes. And then it just passed, and that's it. It won't come back. Dear viewer, if it has happened once, it will come back a second time if you don't pay attention to it. All right, Olesya, yes, thank you for sharing your results. Can you share some parting words or advice for our viewers?
I wish everyone good health. The use of additional vitamins, these biological supplements, given our currently insufficient nutrition, biologically active substances that help us further prolong our health and vitality. Have a great day and stay positive.
Thank you very much, dear viewers. If you enjoyed this interview and found it informative and helpful, of course, like our video, subscribe to our social media. And feel free to ask for help on social media if you need it. Olesya, as a doctor, obstetrician-gynecologist, and reproductive specialist, all the best. Goodbye.
All the best. Goodbye.